Samut Sakhon is actually preparing the field hospital because they expect this number. And they said that right now they have about over 1,000 beds. And by Friday, there will be about another 1,400. And they have talked to the private sector, factory owners, and many places, and they believe that they will be able to provide about 3,000 beds in total to handle all these new infection cases. Dr. Pisamai told at the new conference this morning that the number of beds they have available is 1,091 beds. She appealed to the private hospital to help the mass screening process, without which 10,000 per day target may not be achieved. She said so far, the official had help from the private sector and also requesting help to the military doctor, but they also asked the private hospital to also help with collecting samples, taking tests from general public. The mass screening she was talking about will focus on migrant workers in factories, communities, and dormitories in the province. Infections in the province have reached 5,480 since December 17th, most of whom are migrant workers. The infection rate among them is about 7%. That's why Dr. Pisamai come up with number 800 because they try to screen about 10,000 people per day. Samut Sakhon is Thailand's current hotspot for COVID-19 infections due to the poor living conditions in the cramped dormitories of the migrant workers from Myanmar, creating an ideal environment for the spread of the virus. Dr. Pisamai said that the severe cases will be sent to normal hospitals for treatment, while those with mild symptoms or asymptomatic cases will be housed in the field hospitals. Looking at the big picture, she said, the rate of new infections fell yesterday and today, with new cases being reported in just 7 provinces compared to more than 30 during the initial stage of the second outbreak.